Are you struggling with shoulder dysfunction or pain? Steal this strategy from me. Hi, I'm Dr. Vinod Somareddy, Reddy Care Physical Therapy. We're going to talk about a strategy that is really important to helping your shoulders get strong. That's commonly not really utilized in the gym setting or in rehabilitation. Commonly, the shoulder is really treated with the focus on the rotator cuff and the deltoids from the front and from the back. Oftentimes, people forget about one important muscle of the deltoid complex, which is your posterior deltoid. The posterior deltoid sits behind your shoulder, back through here, and actually helps support your shoulders and keeps them back. They're a smaller muscle as part of the overall shoulder complex, but they do provide a lot of stability for the shoulder when you're trying to move their motion going back. And as you can imagine, keeping your arms strong in this direction is a vital aspect of it because people do reach back and turn and rotate. So having that strength in your posterior shoulder is super, super important. All right, so I'm gonna go ahead and grab a weight. It's not vital that you use a weight for this exercise because it's pretty tough to begin with. However, I'm gonna demonstrate with a weight today. And this could be done many variations, but I'm gonna use a bench on a bit of an incline to actually get the shoulder into a position where the resistance with the weight is more optimal for resistance to the joint. So the basis of this exercise, you wanna have a bench here you can lay down with enough room to leave the weight off the ground. And you want this starting position right here. Because right now in this position, the posterior delt muscle is in the most stretched position. So as it moves upward, it contracts the whole way through. So as you come down slow, and then you go back up slow as well, and down slow. Some people want to go quick, which really is fine, but overall, the most important thing is that you get the starting position right and the ending position right, which is going to be here. So that's simply the motion, and that's the action of the posterior delt muscle. I understand that most people don't always have a bench to use or don't want to lay down an incline. And this exercise is actually more of a later on in rehabilitation potential exercise to use or a training exercise in general. But that particular position puts the posterior shoulder, the muscle in the back here, in the best stretched position so that way you could use its contraction from the beginning all the way through to the end. If you don't want to lay on a bench, there are different ways of doing it where you can do it seated with a band. If you wish to do it that way with a light band even, or even if you just didn't have a band and you just want to start doing exercise like this, sitting in bed or, just sitting and watching TV, you can start to engage those muscles. You don't want to have your shoulders hiked up because you don't want to use all these muscles here. Remember, the muscle you're trying to work on is the posterior delt muscle. So in this position, you isolate the muscle completely, and it's a fantastic muscle to train to get the back of your arm strong. So your shoulders can sit back, your rotator cuff could sit back in the right position, and you're in a good posture overall through utilizing that posterior delt muscle. One of the important things about understanding the shoulder is that there are movements that are easy to do, right? Raising forward is easy to do, pushing upward is easy to do, and people forget just inherently about the posterior delt because it actually is a motion that goes from here to here if you're gonna do resistance with it. I mean, you're not gonna go beyond this, so if you're going from here to here, that's the motion. If you think about that motion, it's a motion that a lot of people use all the time, right? From turning back or grabbing something and turning it this way, or reaching here and going this way, or reaching even back to pick something up. And as they get older, they tend not to do that, right? They tend to turn and rotate their body. But they lose the functionality of these posterior muscles, which are extremely important toward helping stabilize your shoulder and eliminate shoulder pain and dysfunction. So it's something that people forget, and I think overall, if you could train your body to use these muscles in a fashion that is really functional, it's worth it. So yeah, is it more difficult to lay on a bench and put your body and your chest and your spine and position yourself to get the perfect positioning for that shoulder to be, that shoulder muscle, that posterior delt muscle to be resisted through? Yeah, it's difficult, but actually the benefit you get from it is far superior because you're engaging a muscle that is commonly not used and not trained well enough. So don't use heavy weights if you don't need to. Keep your form really good. Get your starting position, your ending position correct. And remember, it is a part of the rehabilitation program through any shoulder sort of program, and it is also part of an athletic program. Keep it simple. It doesn't have to be complicated. It doesn't have to involve a lot of different things, but incorporate it into all the activities you do. This is Dr. Vinod Somareddy, Reddy Care Physical Therapy. If you found the content helpful, like, subscribe, and turn on your notifications.